Because I talk softly, everybody needs to make sure they hear me. So I have like 20 microphones on me. Are everybody hearing now? Okay, thank you. Okay, so we're treating all those things that we all hate when we look in the mirror, right? When we're watching it. So this is what I want to tell you. If you're sitting next to somebody, turn to them. And I want you to, one person do this with your hands and pull up. And the other person looking at them, I want you to look at their neck and see what happens. So what happens when we do this? What happens to the neck? Do you see that? When we do this on the face, our neck improves. So look in the mirror at home, do that, and look at your neck. Because we all do that all the time when we look at our face and we go, oh, wow, there I am. My folds are gone, whatever. But do that, look at your neck, and you're going to see it significantly improve. So I learned that early on in my career. And what we do is we have to start up here. So if I have a patient that comes in and they're complaining about their neck, I always show them that right away. So I explain to them we have to start at the top. So we're going to do things on the face. So here are the secrets, and I'm just going to go through, I'm not even going to read through all this list, but these are all the things that we can do in the office to help you with your neck and your jawline. So it's quite a list. And I think the reason you're here is to figure out, where do I start? What do I do? Or if I've started, what can I add to what I'm doing? So what things did I forget to tell you about that you can do that are going to improve your neck? So we'll go on and we're gonna, we got this in a little bit of wrong order, sorry. We'll come back to that. So we talk about lifting the face. So we have modalities, so we have machines that can lift your face, because that's where we wanna start, and treat your neck. But we also have fillers that can do the same thing. So I'm sure most of you have heard about my treatment that I have, the Lift and Tight, RENU Lift and Tight. Anybody here who doesn't know what that is? And don't be afraid to raise your hand. Okay, so RENU Lift and Tight is actually something that you can only get at RENU, and it's a combination of two machines. And one is to lift, which is the Ultherapy that you saw there. And the other one is to tighten the skin, and it's brightening the skin. It's going to treat lines, pigment, wrinkles, and together they give an amazing result. And I have millions of pictures that I'm going to show you today. So I'll come back to this slide a little bit about the different areas that we can treat. Filler, same thing. We're going to do different types of filler in different areas to treat your face and to lift it, and to also treat the neck. So I'm going to go into a couple pictures, and then I'm going to come back to some of these slides. All right, so we have all these different modalities that are going to treat. And basically, when you come in, I'll take a look at you. We have to find out, do you have an event coming up? Do you need something done quickly? Do you have time to wait for something to happen? Are you afraid of needles? Are you more interested in machines? And I'll tell you, lately, I would say in the past couple years, people are drifting away from wanting fillers. And I think most of that is because a lot of bad work is running around out there. A lot of people are too full. They're puffed up and they get puffy face, and they don't look natural. So there's a lot of things on social media talking about filler can migrate from here down to your big toe, which is kind of crazy. I mean, filler can migrate, but within reason. I mean, our face is divided into different sections, so things can't really run from like here to here. So I think filler has a place if it's done right. So we talk about all these things, and then we personalize a plan for you to get you the right treatment. So this is somebody who had a submental lift and tight. So I'm going to go back and show you what that is. The lift and tight, again, is the Ultherapy, which is focused ultrasound, single treatment, lasts 2 to 3 years and no downtime, combined with our laser, which can be a single treatment combined with it, or you can do an extra 2 lasers. And that one has a little downtime, and I'm going to go back to those other pictures to show you that. So what we've gotten from this is she's gotten smoothing and tightening of her neck. You can see less of her necklace lines there. She's gotten improvement in her jawline. So that profile that I was talking to you about, this angle that none of us see, when we look in the mirror, now we can show her that we've improved that. We've actually lifted her tissue. If you look at her cheek there, it looks like she's got a little more fullness there, right? But you'll notice that I did not put any filler in there. And the reason for this is we have different fat pads in our face. And as we're aging, those fat pads actually will shrink. We lose them. We have bone structure in our face down deep. And as we're aging, that bone will shrink and we lose that. So we lose the fat pads and our bones shrink and we lose those supportive structures. When we use the alt therapy, which goes down to our SMAS, which is that line that she showed you of your dermis, which is the top layer, and then down deep you have your SMAS, which actually is like the mattress that holds up your tissue. When we go down to that layer and tighten it up and lift it, it actually lifts those fat pads back into place. Another trick you can do when you look in the mirror is look at yourself at rest and then look at yourself smiling. And when you smile, our cheeks get bigger. And the reason for that is because we lift that fat pad back into place. And I use that as a tool when my patients come in. If I'm doing filler, I want to see what their face looked like naturally before they had lost some of their fat pads. And if I have every one of you here smile and look at me, smile, I can tell exactly how big your cheeks were before. So now I know, did you have really prominent cheeks? Do we need to put a little filler there? Or are we going to get enough just by lifting you from out here? So that's going to give us that definition. And when we do the alt therapy, it moves our fat pads into place and it looks like we've added some volume. Does everybody see that on her? You actually can see that. And when you're looking at these alt therapy lift and tights, or even just the alt therapy alone, just notice that the volume that looks like we've added, but we didn't add. So now I'm going to go back here and show you exactly on this what she had done. So if you look on the alt therapy side, she had just the under, it's called submental. So she had just tightening under here. No lifting actually even of her face. She had tightening here, and then she had the laser done on her full face. And that's the result that she got. So now we have bright and tight. So bright and tight is something called the EndyMed radio frequency, and it's paired with the laser. So these are treatments that you can't get in any other office because I made them up. And the reason that we love them is because they work so well. So you can see the EndyMed, it's radio frequency, and the beauty of this machine is there's absolutely no pain, there's no downtime, it's really easy. It's 4 treatments, and they're done 1 to 2 weeks apart. And what we do with one of those treatments, so somebody picks one of the days when they want to have a little bit of downtime with the laser, we combine it with the laser that day. So that's the bright and tight. And so what you can see has happened with her, she has more definition of her jawline. And actually her profile is not bad. She's got a pretty decent jawline. She just has some, I'm pointing at my computer instead of up there, but she just has a little bit of lax skin there. But when we tighten that, her jawline is even more spectacular. And then you can see the tightening she had on her neck, and she had, the lines are much smoother. Everybody see the difference in there? So it's a beautiful result there. So this again is radio frequency combined with laser. So the other one was the alt therapy combined with laser. And if you're kind of wondering what's the difference between the alt therapy and the radio frequency is higher up in that tissue layer. So when we talk about the dermis, that's that first area you can see on the All Therapy machine. That is where we're hitting with the radiofrequency. We're tightening that layer. With the All Therapy, we're actually going down deeper into the tissue, and we're targeting something called the SMAS, which is actually the same plane that the surgeon goes to when they're going to do a facelift. In the face, we call it the SMAS. In the neck, we call it the platysma. And those tissues, when we tighten them, they actually lift. So the All Therapy, you get tightening and lifting. With the radiofrequency, you're just really getting tightening of the deeper tissues. And then with the laser on top, you're cleaning up pigment, you're helping with lines, wrinkles, tightening, and you can even, like I said, you can even tighten on the eyes. And one thing that I would add to her is she has those neck bands. Does everybody know what neck bands are? If you make a monster face like that, you can see if you have prominent neck bands. So these neck bands, we can actually put a little Botox in there, like Botoxium in our Dysport, and it will relax those bands, and they just lay right back down on the neck. So that's something you can do, and it will usually last 3 to 6 months. So if I was going to be critical about what else I would do for her, is I would relax her neck bands, and then they'd lay down a little flatter on her neck.
So can the EndyMed go straight down here?
Yes, you can do the EndyMed on your neck as well here. So our most popular areas for EndyMed is low face and neck. And the beauty of it is, does it work? If I had to choose between which machine I chose for somebody, All Therapy versus EndyMed, I'm going to choose the All Therapy all day long because we're getting the lifting. And to be honest with you, there's absolutely no other machine out there in aesthetics that does lift. There are some machines that say they lift, but this is the only one that really does lift. So I would choose that for the lifting because it's nice to get that. You know, everybody wants a little bit of a facelift. But the EndyMed, it does a nice job. I would call it more of almost sculpting. And you can see that on that patient that we saw right before that. So this patient, she has, and everybody okay with this format, kind of going through the before and afters and just explaining the procedures and what they've done. If you have questions, just pop your hand up and ask me. This is casual. In fact, I love it when you ask questions. And online, if you have questions, just pop them in there and they'll relate them to me. So this is quite an amazing feat here that we did. She actually had the RENU laser, which is the laser it's on the surface, but it actually kind of goes deeper into the dermis. And it's, again, treating lines, wrinkles, and tightening. So if she had just that laser, probably she wouldn't have gotten rid of her jowls the way she did. But she had that laser. She had a little Botox for these bands. So you can see her band is relaxed, but not completely flat, but it relaxed quite a bit. She also had a Sculptra neck wash on there. And the Sculptra neck wash, does everybody know what Sculptra is? I'm going to go ahead and explain it because I am loving Sculptra. And I'm changing things the way I'm injecting now, and you're going to hear a lot more about Sculptra. I've been doing it for a long time, but I've always been telling people to choose Sculptra or something else, and now I'm more wanting you to do Sculptra. It is called a polylactic acid, which means nothing to you. It's basically what resorbable sutures are made from, and it's ground up, and we mix it with sterile water and a little lidocaine, and then inject it into the face to give you volume. And the day you have it is amazing. It's just like, wow, you've got all this volume back on your face, put in all the right places, so it lifts everything up. But 48 hours later, you look in the mirror and you're like, it's gone. So the fluid that I mixed is all gone, and what you have left is these PLLA particles that are in there, and they're like seeds, and they're going to grow your collagen. They're going to stimulate your collagen. So this happens very slowly. It takes about 2 to 3 months to see your full results, but it's amazing. So what I do on the neck is I dilute it, so it's not going to really give you as much volume, but it's just going to stimulate the collagen from the inside out. So we're getting collagen stimulation from the outside in and tightening, and we're getting collagen stimulation from the inside out with the Sculptra. And that's one of the best ways that you can treat your neck and get some really nice smoothing. And it obviously has a great result. Any questions about that? Before I continue on, I just want to talk to you a little bit more about the laser. Yeah.
What are the differences in people's age groups as far as how these things?
So we have amazing amount of collagen, and it actually starts to decrease in our 30s. So obviously you're going to have a better result with collagen in your 30s, 40s, and people are doing Sculptra younger and younger now. They're starting like in their 30s and preventing, and they're just not doing as much of it, but they're stimulating collagen and preventing it. So the interesting thing is, though, I haven't seen a huge difference between my younger ones and my older ones, to tell you the truth. Now, somebody might need a little more sessions of Sculptra to get where they want to get, but they're still getting collagen stimulation.
Will it stimulate collagen no matter how old you are?
Mm-hmm. I have patients in their 80s that are doing Sculptra and are enjoying it. And of course, it's going to take a little bit more than it would in your 30s. Somebody in their 30s could do a vial and do like 1 vial a year to, keep it up. Now, everybody, when they get to their goal with Sculptra, we do sessions. I do no more than 2 vials at a time, and I do those sessions 8 weeks apart. So we put it in, and then 8 weeks later, make sure that you're getting some result, then we add more, and then we can add more every 8 weeks until we get where we want to get. Now, typically, most of my patients are doing 4, maybe 5 vials. So that's 2, maybe 3 sessions. Once they look in the mirror and they're where they want to be, then they do 1 vial once a year to maintain it. So I call it a little bit of front loaded as far as, cost wise, but then down the line, it's just 1 vial once a year. But I'm starting to play around with it a little bit, where I'm not going to make everybody, if you're wanting to do Sculptra, it's like either Sculptra or something else. I'm combining Sculptra with other fillers. So I'm combining it with the hyaluronic acid fillers, and that's where on this chart you could see. So I use the hyaluronic acid fillers to give you your immediate result, and also to kind of give some fertilization, because the hyaluronic acid inside there will give a little fertilization to help grow and stimulate the collagen. And then with the Sculptra in there at the same time to also stimulate your collagen. So maybe we don't have to rely on just the Sculptra to build. We're going to do it in combination with a hyaluronic acid product. And I think the results are nice with that, because you get your immediate gratification, but you're still getting that collagen stimulation that's going to last longer. And that way you do your, you could even just do 1 Sculptra, see how you like it, and just do 1 once a year with your hyaluronic acid filler. And it's a great way to do that. So the neck, you can do the Sculptra wash on the neck or the body. I just did an abdomen today. It's going to stimulate that collagen from the inside out. And then our laser on top of it's going to stimulate from the outside in. The other thing we can do in the neck with filler is we can take Bellatero, which is a very thin hyaluronic acid filler, and we can put that directly into those necklace lines that everybody gets. The necklace lines that aren't like pretty necklaces. And we can put it right in there, and it helps smooth those lines. And it's amazing. You do get a little bit of bruising there, but it's really pretty. And it's better too if you have like deep necklace lines that maybe the laser is not going to get rid of, then you can get a little immediate gratification with Bellatero. So those are the modalities for fillers for treating the neck. And I wanted to show you the pictures of our laser. So the laser, the beauty of this CO2 laser is that in the past, the downtime used to be 7 to 10 days. The cool peel, you can put makeup on it 24 hours and you can be back out at pickleball, golf, tennis within 48 hours with hat and sunscreen. Now, if we go deeper, if we get into some, like say you have really deep lines here around your mouth, we could do that area of the face a little bit deeper. You're going to have a little more downtime. And that's something we'll talk about. But all these treatments are very personalized just for you and just to, get you to your personal goals. So, sorry. Monica's been she's been our star tonight. So this is basically Monica. The first one is her before her laser. That is immediately after. And then the next one, I think, was 24 hours later, right, Monica? 48 hours, yeah. So a couple days later. And she looks almost the same as she did day one. So pretty amazing. And this is Jisa, who gets much redder. So everybody's going to respond a little bit different. So this is probably like your worst case scenario, right? She is. But it's good to see that, right? It's good to see like here's the star, here's rock star, and she's a sensitive girl. So, but still, even that by, the immediately after next morning, she's really pretty bright red. But by day 3, she's, she could be out. That's day 3. She could be out with makeup on and look pretty good. So, and definitely by day 7, she's back to her just gorgeous porcelain skin again. All right, we'll go through some more before and afters. I have a million of them, so when you get tired of seeing them, say uncle and we'll stop. Okay, so we've got, this is Lift and Tight. Oh, that one we did already. So this is another Bright and Tight. So this is the EndyMed radio frequency with the laser with it. So these are all machines. And like I said, most people lately are coming in and, even my new patients, they're wanting machines. Even some of my old patients are like, well, I've done filler, but I really want the machines. And the machines are beautiful because they're very natural. Nobody's ever going to look overdone with them. They're not going to look crazy different. Now that can happen with filler, but not in my hands really. I mean, when I do the filler, you're going to look natural. You're going to look like you used to look maybe 10, 15 years ago, but you're not going to look crazy. So this is another radio frequency. All right, the name of our machine is EndyMed. And this is only radio frequency, no laser with it. So she had 4 treatments done 1 to 2 weeks apart. She had no pain with it, no downtime. It feels like a warm massage. And Gisa or Monica does the treatment, and it's just like sculpting the face. I loved when I did the radio frequencies because it was really like just sculpting somebody's face. And if they had a little jowl, you could, just kind of hang out in that area to help it. Which, speaking of jowls, does everybody here know that we can permanently melt your jowls? Or permanently melt the wattle here? So we have an injection that we can do. It's 2 sessions. They're done 8 weeks apart. And the area will get about 50% bigger than it is now, but that only lasts for about 5 days. And then it does help tighten the skin most of the time. And you have just it kind of makes it go away. And it's the same product that is used in Kybella. However, the product that I get is actually stronger than Kybella because Kybella is a little bit, more dilute. And I mix it myself, so I put lidocaine in it. It makes it much more comfortable. So it's a really easy treatment to do. But she didn't need that. She was able to do the EndyMed and get rid of that. So this is another Lift and Tight with radius. So what is Lift and Tight? Hopefully by the time you guys leave here, you'll hear it enough that you know. What two machines? GSA. All therapy combined with Monica. Laser. Yep. So that's what we did with her. She did the alt therapy to lift, and she did the laser together, and she also did filler. So this is the combination of the three modalities. So the filler that she did was Radius. I'm not using as much Radius anymore. I'm going more towards Sculptra and the hyaluronic acid fillers. So this is another picture of her. And I mean, these results are amazing to me. The tightening under here. And, you know, I mean, sometimes you're going to say, well, you have a little bit of it, but nobody, you know, some people get perfection. And I think that's, to me, close to perfection. Do you agree? We're all happy with that. And the nice thing, too, you can see that this little dent, this break that people get, we call a submalar break, that actually is lifted up as well. And that has to do with both the filler lifting and the alt therapy lifting up the tissues. So here we have another one. So DCA is the injections for the fat that we did. And this is Radius, which is filler to lift. And then the lift and tight, which is which two machines? There we go. So she had lifting with the filler, lifting with the alt therapy, tightening and brightening. Look at her skin tone and everything. It looks amazing. And then the great thing is, you know, a lot of people would look at the neck and that loss of definition and, you know, you know, you can't really see her jawline as well and think that she had surgery. And I just had a patient the other day who's getting ready to have surgery on her neck. And she's like, well, they can't do this. You can't do this with a machine. But yes, we can, actually. We can get a nice, I'm not going to say that, you know, we're a substitute for surgery. If somebody really wants to have surgery, I say go have surgery because you may not be happy if you don't. But we can do a lot without surgery and get some really amazing, natural, beautiful results. And that's another view of her. So just, I mean, I love how we just pop that jawline out. And the skin tone is amazing too. So this is a RENU Cool Laser and a Sculptra Neck Wash. So the RENU Cool Laser, again, brightening, tightening pigment, wrinkles, lines. And then you can just see how much tightening she got on her neck, both from the outside in and with the Sculptra Neck Wash from the inside out. Any questions as we're going? No? So Cool Laser, Sculptra Neck Wash, so same modalities again. And this one is a dermal renew alt therapy, which is something I really don't do much anymore, but that's basically when you're doing the alt therapy just on the top layer of the skin to tighten the skin. And the reason I don't do that is because I get so much more out of doing it with the laser because we're going to hit the pigment. If you're just tightening with the alt therapy, which we can do if people don't want downtime, you'll get the tightening, but you won't get the treatment of the pigment. And this is filler and the Cool Laser. So we've cleaned up her pigment, tightened her tissue. I mean, you can see how much tightening she has around her mouth. Is amazing. And then this is filler and then a Radius neck wash. So Radius is also a collagen stimulating filler, and we put them together and do the neck wash, and that's building collagen again inside out and outside in with the laser. And then she had the Botox, which is the different brand, which is Xeomin, on her necklace lines. And we do something called a Nefertiti lift. So that just means putting the tucks at the edge here to relax the pull down of your platysma. And so you can actually just put Botox there and it will help define your jawline. The nice thing is with the machines, it's going to last longer, but this just gives you another way to define that jawline with injectables. And this is another radius, so lifting with filler, and then the lift and tight, which is basically alt therapy and the laser. You getting tired of these yet? All right. So basically, what I like to say is that, we have all these things, and I didn't talk much about skincare, but skincare is another modality that's on there. For skincare, we have a neck cream from Neocutis, and it's called Neoform, right? And actually, if you use it, it will give you tightening of your skin. Not as much as you would get, obviously, with a laser or with the other modalities, but it's just another simple thing to do. So, like, if you're not ready to commit to machines, you could do that. Also, Retin-A or retinol. Alpha Red is one that's really nice and easy to use on the neck without giving a lot of redness and peeling and things like that. And then sunscreen, obviously. So what I like to tell people is a lot of times, whatever you're using on your face, please don't forget about using it on your neck and your décolleté and your hands, because these are going to age as well, especially we all live in Florida, we're in the sun. Yes, we can laser these areas to try to catch them up, but it's better if we do some preventive treatment. So the skincare is really preventative and maintenance for after you've done these machines. And then we have the Botox we talked about for the neck band, the injections that melt the fat for you. We have microneedling, which we really didn't talk about, but if you don't want the downtime with laser, microneedling is always another option because it's stimulating your collagen. And then we have filler for giving you more of an immediate snatched jawline. And like I said, go home in the mirror and see if you're filling and you're lifting this up, you're going to immediately just, improve your neck by doing that. And then the Sculptra and Radius washes in the neck to build collagen inside out. But I have to tell you, if anybody walks in my office, my preference is that everybody do their lift and tight. Obviously, it's a very powerful tool, and it's going to give you that basis to help treat the things that are happening when we age and to help prevent. And you can do the combination of the lift and tight, which is the alt therapy, or you can do the bright and tight, which you won't get as much lifting. But I find these the base, and then I would recommend in a month you come back, and then we do the things above that are fine tuning. So it's kind of a little bit of a better direction, I think, where you're doing that base and then you're tweaking on top of it. So tonight, everything I've talked about, which is a lot of different things, is basically 15% off tonight. And I'm happy to do a consult for you and see where you want to go. Any questions? No? Hopefully you heard something new tonight. Hopefully it's not all the same old stuff, because we're always changing the way we're doing things. Sometimes it's the same tools used in different ways. And a lot of times this is way too much to go over when you're in the office and we're going in certain directions. So sometimes things hit a little chord that strike you as, I think I might enjoy that. That might treat my ex, or, treat this. So, no questions? You guys are quiet tonight.
So you wouldn't do any kind of filler on the day that you do the lifting?
It depends on how we're doing them. So we do that, but I like to do the filler where we're doing down deep on bone, where we're doing it down deep so that the alt therapy is really not going to get to it. So I would do that to kind of tack it up, and then we can do the alt therapy right over that. But when I start using the cannula, so if I go back to, sorry, anybody has seizures, don't look. When I go back to how I put the fillers in, I can put down deep on bone, which when you put it, I know this sounds I don't know if you want to hear this, but when you put it down deep between bone and muscle, that's where you get most of the lift. And especially if you put out here, there's something called the line and ligaments. You put it back here, and you're going to get lifting. So that I'll do all day long before an alt therapy. But then some of, like if I'm doing sculpture, I don't like to do sculpture and alt therapy the same day, because sculpture you have to massage it in afterwards because it's mixed in with the fluid. And I'm going at a different plane that might be a little more superficial and something we might be able to hit with the alt therapy. So Botox, yes. So the way we would do it is we would do the alt therapy, then we would do the laser, and then you'd come in and do your Botox. So you get to see all the different rooms in the office that way. And we do have patients that hit almost every room when they come in if they're doing, a few different procedures. So, yeah, good question though. Excellent question.
So how many days after the Botox can you do therapy?
48 hours.
Oh, okay.
Actually, I like to say 72 just to be on the safe side, but yeah, just so that you don't cause, because when you do the alt therapy, I say no downtime, but you do get a little bit of swelling, but it's nice swelling. Like I love when I have my face swollen from alt therapy, but if we have some of that swelling, it might move the Botox around. So I like to say like 72 hours after. Yeah. Good question.
Yeah, because I did Botox Tuesday.
Yeah, so you're fine. I already figured that out. But thanks for checking me.
Yeah.
Yeah, so you're fine with that. Yeah, it's great. I tell you, I had a year where I couldn't do my alt therapy because I was on a medication, and it was a tough year. I couldn't wait. Like within a month after I got off my medicine, I was like, "Come on, Giselle, let's do this. Let's get it done." Pardon? My code word. Yes, thank you. So for all of you sitting at home drinking a martini, our code word for tonight is going to be uplifting. So if you call the office tomorrow and say uplifting to Monica, Gisa, or Kim, you will get your 15% off. Did you guys enjoy the format of tonight? I think it's great to see the visual. I feel like it's if you hear all that information without seeing what it's doing or how it's behaving, then it's harder. But if you see the pictures to see what results somebody got, and these are real results. We don't doctor our pictures up or do anything. If we don't see a result, we'll say to a patient, you know what? I agree with you. We're not seeing a result. But that happens very rarely, very rarely. All right. You guys were amazing. And I'm happy to talk to anybody. We've got more food. We've got more wine. And, I welcome any questions. Pardon? You need a driver? We'll Uber you home if you need to. All right. Everybody have great Halloween's done. Great Thanksgiving plans? Yeah? No? Yeah. Gee whiz. I know this year is going fast. It's going way too fast. Oh, our raffle. Ladies, you let me forget the raffle. How could you guys let me forget the raffle? We are raffling off a bio cream. So, anybody here have dry skin? Nobody has dry skin. Yeah, this is the best. This is probably one of our better selling creams. It's a really great hydrator. So I don't talk about moisturizers. Moisturizers are bad words because we want hydration.
Fresh Capra.
Oh,
Yay! Have you ever had the bio cream before? Did you? Well, I used to polish one.
I don't think so.
No, different.
Ishan, we're off, right?
With like,
oh.
growth.
Off now.